Hey folks, I'm Dr. Ishfaq. I'm a first year specialty trainee and registrar in internal medicine. Regarding Warfarin is an oral anticoagulant drug which is a vitamin K antagonist. There are a set of advices we have to give patients before starting them on Warfarin. We need to educate them on Warfarin regarding what is Warfarin. We need to explain them that this is a drug which will help to thin your blood. This is a drug which will help to stop clotting of your blood. So we need to explain them why we are starting warfarin. It could be due to a tendency of clotting in a patient. It could be due to a valvular disorder in a patient which leads to a rhythm problem like atrial fibrillation, atrial tachycardias, etc. They are conditions which are prone to make clots in your heart which may propagate and cause strokes and multiple thromboembolic conditions. And in a patient who has had venous thrombosis like deep vein thrombosis, pulmonary embolisms following that, they also have to be on warfarin. So we need to first explain them the conditions. Then what we have to do is we need to say that the measure of INR. What is INR? INR is a standardized measure which helps us clinicians to see if your blood is more thin or more in tendency to clot. So a normal person's INR should be 1, closer to 1. But we need your INR to be at a higher level, right? The more higher the INR, more thinner the blood. So we need to make your blood more thinner. So we need to tell them what is the target INR, what's the INR they should be on, whether it is 2 to 2.5 or 2.5 to 3 or more than 3. We need to explain them and we need to make sure that the patient understands what is the importance of INR. And we need to also tell them that taking warfarin, there are interactions with other medications. Like if the patients are on anti-epileptic medications, if the patients are using medications which are involved in inhibiting or inducing the cytochrome P450, or if the patient takes a lot of green vegetables, a lot of greens with their meals, or if the patient takes these tablets, takes warfarin together with meals, they all have an impact on how they work. So the INR resultant will be low and we might end up increasing the warfarin falsely. So we need to look into that. The next thing is we need to always see that if the patient has an idea of what to do if they develop complications. So what are the complications they do develop? They can develop bleeding manifestations. They can develop bleeding PR. They can develop ecchymotic patches all over the skin. They can develop easy bruising, gum bleedings, things like that. So we need to advise your patient that if you see that you are passing stools, dark tardy stools like melena or PR bleeding, or if you're vomiting blood, vomiting coffee ground, and if you're having these ecchymotic patches on your body which are developing or increasing, or if you had a fall and you had a muscle hematoma which is expanding, stop warfarin immediately, go to the nearest hospital, get yourself an INR and get yourself checked and get yourself seen by a doctor. So these are the things what we have to advise a patient before starting on warfarin, and we need to make sure that in our setting in Sri Lanka, we need to explain them what's the cost of an INR. Not all hospitals have facilities to do INR. So in case of an absence of those tests in government hospitals, those patients should be able to get them done in the private sector. It will cost around 3,000 to 4,000 rupees in various laboratories in Sri Lanka. So INR test is very important, and usually they have to do it every month so that we assess them. At times they have to do more than that, at times they have to do frequently than that. If their INR is labile, if their INR is much less or much higher, we need to repeat them in 4 days or in 5 days depending on how we increase and decrease warfarin. So these sort of things have to be educated, and patient has to understand it properly and give consent so that we can start them on warfarin, have a fruitful effect of warfarin. Thank you guys, stay tuned for more.